Hi, my name is Dr. Angela Fals, and I'm the Medical Director at Advent Health for Children for our Pediatric Healthy Weight and Wellness Program. I am also a certified culinary medicine specialist. Culinary medicine means a lot to me, both on a personal and a professional level. On a personal level, I was raised by a mom who was very much about health and wellness, and so probably she is responsible primarily for getting me into pediatric obesity medicine and my interest. And she was very, very healthy. We lost her 10 years ago to ovarian cancer, and the kitchen was a way for me to kind of reconnect and connect with my mom and the memories that we had together. I could see her hands, I could, hear her giving me instructions in the kitchen. And it was a way for me to kind of reconnect there and have memories and relive them and provide comfort and healing for me. And concurrently, I wanted to take my passion for intensive healthy lifestyle and behavioral treatments and interventions for children and families a step further. And so I ran into American College of Culinary Medicine and Health Meets Food, and it has really been extremely fulfilling to me. I have been able now to work with a focus of prenatal through early adulthood. So we work now with pediatric residents, OBGYN residents, and family medicine residents, both our DO and MD programs. And the idea is to have a greater impact on childhood obesity from those key moments. So prenatal, toddler, tween and teen, and early adulthood, so that they're entering adulthood with a confidence and an education that they're able to keep with them for a lifetime. Being a certified culinary medicine specialist has opened doors for me that otherwise would not have opened. It's giving me the education and the confidence to be able to talk more freely about food as medicine, about how to also teach residents and medical students, and then impart that not only into their lives, but into the community. It's also given me the opportunity to have a publication and really enter into the world of culinary medicine more deeply for my own edification, as well as that for my families and my kids in the practice. That's $1 million question, right? How do you combine it with everything else that you have going on? And I've spoken with several other attendees, and that is a big challenge that we have. Many of us wear many different hats, both outside and inside of the hospital and practice. And it really is something that has been doable. I worked on my certification took me about a 2 to 3 year process. And it was something that, since I found it fulfilling and healing for me, it was something that just was naturally incorporated into what I did. I also took the opportunity to, while I was practicing at home, let's say, I would have my kids come and cook with me. So being able to help them. And then as I was working on my certification, everything I was learning, then I was also developing curriculum in culinary medicine for our kids of the practice. So all of our kids are at least in the overweight category, and they come to the kitchen house, which is our partner kitchen house, 3 to 4 times a month. And it is all with culinary medicine and chronic disease prevention focus. So that's kind of a way that I figured out how to manage my time and all the different hats that I wear. Oh, don't hesitate to become certified. It is one of the best things that you can do to further not only your education, but also to continue your work in your practice and in your programs and in your community. So that has been a big challenge. However, I have been working with our directors of GME and pediatric and OBGYN and family medicine residencies, and they are probably just as passionate or equally passionate about it. And so we have found a few spots here and there. So for example, every June, we have the interns. All the interns come together to the kitchen house, and we do our session there, which is the Introduction to Culinary Medicine and Safety and Sanitation modules. And then after that, it's really resident dependent. In pediatrics, they have what's called 2 weeks of potpourri, where they have a lot of flexibility. So we have half of the program come in December and half of it in January to do a specific module that they've chosen to do. The last year what we did was they chose the sports nutrition model, and I love it because they got creative and they said, you know what, this can go towards adolescent medicine requirements that we need. So that's how we're starting to do it for them. For the OBGYN residents, they are doing their own specific modules. They're a smaller program, so they have a little bit more flexibility to work with that. So they chose the nutrition and pregnancy model, and then every year we'll be alternating them for about 3 to 4 years of the residency program length. My favorite ingredient is sesame oil. I love edamame, and it takes it to a whole new level. I love Asian food, and so it takes the stir fries to a whole other different level too. And I love the health benefits that come with it.